Kia ora koutou katoa. Good afternoon. I'm joined today by the Director General of Health to make an announcement on relevant to the eligibility for our Covid-19 vaccination campaign, but I'll invite him to join me on the stage at the conclusion of a few opening remarks. First, I'd like to acknowledge everyone impacted by violent weather over the weekend. It has been a distressing time for those in affected communities, particularly Papatoetoe and Tairāwhiti. Lives have been disrupted and homes and businesses damaged. I'd like to express my heartfelt sympathy for the family of Janesh Prasad, who lost his life as a result of the tornado in Auckland. I know everyone's thoughts are with his wife, children, friends and colleagues. The worst of the weather is behind us, but we can expect a significant clean-up effort in those communities hardest hit. Government agencies are there to provide support. You'll have seen we've already contributed funding to the Mayoral Relief Fund to support Auckland communities impacted by the tornado, and MSD is also offering assistance. We're in contact with the Mayor of Auckland and are ready to provide additional financial assistance if required. Assessments are also underway in Tairāwhiti. Once again, we're in contact with the Mayor there and ready to provide support. A huge thank you to all emergency services, local council, MPs and community members for rallying together and supporting one another. A look now to the week ahead. Tomorrow and Wednesday, I'm in Wellington for the House, Cabinet committees and other meetings and briefings. On Thursday, I will return to Canterbury to view progress and recovery from the recent floods and to meet with those affected and those involved with the clean-up. On Friday, I'm in Auckland for meetings and visits, including a trip to a recycling facility in Onehunga, where I'll learn about their work recycling plastic, something that's a matter of priority and urgency for the government, from both an environment and climate perspective. I'll also visit parts of Papatoetoe impacted by the severe weather at the latter half of this week. On Saturday, I will be in Auckland with Minister Seo to deliver the government's apology for the dawn raids. While I don't want to share too much in advance of the event, suffice to say, I know it will be a really significant occasion. Now to our vaccination campaign. I'm pleased to announce that we've been informed that MedSafe has provisionally approved the use of the Pfizer vaccine for New Zealanders aged 12 to 15 years. There are around 265 children in this age bracket, and our existing Pfizer purchase order contains more than enough doses to cover 2 vaccines for this entire group. We would not need to buy any more to cover them, and nor will anyone miss out as a result of MedSafe's advice. MedSafe only grants consent for a vaccine's use in Aotearoa once it's satisfied the vaccine has met standards for safety, efficiency, and efficacy and quality. A number of places, including Canada, the US, Europe, and Japan, have already approved vaccination for 12 to 15-year-olds, and some have begun vaccinating this cohort already. The next step in the process is for this decision from MedSafe to go to Cabinet for a decision to use. You'll recall that that's what happened the last time MedSafe provided that approval. That will occur next week. For now, and as we've always said, the more New Zealanders vaccinated, the stronger our population immunity. While COVID has not generally affected children as severely as it has adults, there have been cases internationally of children getting sick from the virus. In addition, children have shown to transmit the virus, so being able to vaccinate them, as MedSafe has advised is safe to do so, would provide wider protection for the community. The Ministry of Health has been planning for this potential decision by MedSafe and has been working with the Ministry of Education on a potential rollout plan for this group. These are the rollout plan that Cabinet will discuss as part of its decision-making next week. While it's too early to outline specifics, we envisage that schools, as community hubs, could play an important role. But the new age banding does not preclude young people from getting vaccinated with their whānau as our age bands roll out, if that is the decision that Cabinet makes. I just thought I'd give some little context to where we are currently in our vaccination program. Within the next 24 hours, we are scheduled to deliver our 1 millionth dose. It's taken around 5 months to reach that number, but to illustrate how quickly our campaign ramps up from here, we plan to reach our 2 millionth dose in roughly 6 to 7 weeks' time. The vaccination campaign, as we've said, is the largest and most complex undertaking our health system has ever rolled out. The vaccine is how we will protect each other from the virus, and vaccinating all those who are eligible will help us maintain our COVID-free status. I'll now ask Dr. Bloomfield to join me at the podium in case there are other questions you may choose to ask about MedSafe's decision that are of a more technical nature. Happy to take your questions. Jessica.
What assurances do you give to parents who are nervous about vaccinating 12, 13, 14 and 15-year-olds?
The most important part of these early stages of New Zealand's vaccine decision-making has been the independent approval process of MedSafe. They are making this decision based on clinical advice, based on research and based on data. And that's been a really important part of the reassurance process for every New Zealander.
The WHO have said that rich countries should be letting poorer countries get their essential and high-risk workers done first before vaccinating low-risk people, including children. Shouldn't we listen to that advice?
And of course, you'll see that from the delivery of vaccine supply into New Zealand, our program really ramps up in the second half of the year. We've always said it will take us a full year to vaccinate our entire population, and that's based on the supply that we are receiving from the pharmaceutical companies. So that gives you a bit of a sense that there is a level of prioritisation happening around the world as those essential workers are being vaccinated.
Fair though?
Is it fair?
Is it fair for us to vaccinate right down to 12-year-olds when other countries are struggling
Well,
to get them?
you'll see that, of course, our vaccination process is taking us the better part of a year, and that is based on supply. What we're also doing, though, is supporting vaccination rollout in other countries. Just today, sending some health support into Fiji to support some of their COVID response. We've donated significant doses back out into other countries who may not have secured their own and made donations to support the vaccination efforts globally.
If the technical advisory group recommends that, or advises that you don't actually roll out to this age group because the others should be the priority, will you take that advice on board and potentially delay it?
Oh, look, absolutely. You know, for us, the number one priority has always been the safety of all New Zealanders, and we've always applied an independent process. So MedSafe have given this approval, they take that through their independent advisory process, and then it comes to Cabinet for a final decision to use, and we will listen to that advice every step of the way.
Is that decision is it likely that Cabinet will approve this?
Oh, look, we lean heavily on that advice from our independent advisors. So we rely on MedSafe approval. We don't make clinical judgments. So if their view is that it is safe to roll out, then Cabinet is likely to agree with that and support the rollout. That's because, I mean, if we head down in the future, MedSafe having given approval for this age band to be vaccinated, but Cabinet for some reason decided not to, imagine then if you had a young person in that age group affected fatally by COVID. I mean, that would be a very, very hard burden for any of us to bear if we'd made a decision counter to official advice.
The government's plans.
But if it's so not the MedSafe approval, but if the technical advisory group says that there should be other groups which should be prioritised and teenagers shouldn't be the group maybe later on in the vaccination campaign, is that something that...
I'll let Dr. Bloomfield speak to that, but just keeping in mind, I think their consideration, the decision to use is often when we're talking about how we're sequencing, those decisions often being made at Cabinet. And you'll see we already have created a structure that really strongly prioritises those most likely to be affected by COVID-19. The one exception I make is we've often then done the family around our border workers for good reason.
Thanks, Prime Minister. Kia ora koutou. So yes, the technical advisory group that is convened and chaired by Dr. Ian Town actually discussed this briefly last week. They were waiting for the firm decision and approval by MedSafe, which has just been gazetted, and they're going to consider again tomorrow. They have no concerns about safety, tolerability and immunogenicity of the vaccine, and indeed efficacy. It's been shown in a very good study published in the New England Journal of Medicine that it's safe and efficacious for this group. What they were most interested in was giving some advice about timing and the best way to ensure that this group is accessed fairly so that we particularly get those Māori and Pacifica populations, because we know that those groups have a younger age structure. So it will be particularly important to be able to reach down into that 12 to 15-year age group. So I'm expecting they will provide some advice on those issues specifically, and then we'll reflect that in the advice to Cabinet.
So is it likely that they'll be in the same sequencing group as the under 35s, or could it be that the 12 to 15-year-old age bracket could even be next year?
No, so there's no part of our population that we at this point are planning for their eligibility to come up anytime other than this year. We've got enough vaccine coming into the country that everyone who would be eligible, including this group, if that's where the final advice lands, will be able to receive a vaccination this year. Again, in terms of the sequencing, the things that we're taking into account, for instance, yes, we've got the age bands based on risk to individuals, but also we've got to blend in some efficiency here as well. So in some cases, if you've got a whole family, some cases you'll be better off accessing that whole family at one time.
The US FDA approved this vaccine for use in 12 to 15-year-olds about 6 weeks ago, early May. Would you expect, if other regulatory bodies moved to approve the vaccine for use in children even younger, 0 to 12-year-olds, would you expect a similar kind of lag, 6 weeks or so, for MedSafe to essentially check their work and check the studies?
Well, one of the things I would say, I've said it before, is we don't outsource our approval for vaccines and medicines. We've got a good process we've run here, and that relies on our assessors looking at all the data. And it's not just the data from the clinical trials, but it's the manufacturing information as well that's really important. There are trials underway of the Pfizer vaccine in ages 6 to 11, and we'll obviously follow those trials with interest, and when the information and data become available from those trials, MedSafe will assess that to give advice around and make a determination around approval in that younger age group if the trials show it has a good safety profile, tolerability and immunogenicity response, and indeed it shows good effectiveness in that group too.
Made a recommendation on the Janssen vaccine yet, and will that vaccine cover 16 and up, or is there a different age group for that?
So that consideration is still pending, and we're waiting for that advice to come through and for MedSafe to make a decision around approval of the Janssen vaccine, and it has been trialled in 16 and above years, so it's a similar age group.
Is it still the government's intention to lift quarantine-free all the pause with Vic tomorrow?
Well, I was just discussing with Dr. Bloomfield, as we've said right from the moment we gave that indication of a Tuesday reopening, that we would continue to assess information right up until that decision in order to make sure that it's based on the most relevant information and timely information we have. So nothing at this stage has changed that decision, but we will assess any new information overnight.
When's the latest that you will be assessing? Is it right up to the
we always make sure that, of course, it's within reason from when people are likely travelling to flights and flights are due to depart and so on and so forth. Keeping in mind that flights have been moving to repatriate. Sorry?
How are you preparing for just the extra pressure on the rollout if this 12 to 15 is approved? And indeed, I think there are trials now from 6 months all the way up
There are
to
trials, yeah.
11. That if we do get into that area, that's going to be an extra 1 million people that we need to vaccinate with doses. That's going to be on average, I think, 13,000 doses a day. Is the ministry sort of making plans to cope with that if we get to that point?
Well, obviously our plans at the moment are to be able to ramp up capacity to between 50 to 70,000 vaccinations a day, right through to deliver to the current eligible group. This new group is, as the Prime Minister said, around 260,000 12 to 15-year-olds. They would require 2 vaccinations. We have enough vaccine and we think enough capacity in the program to add that group in as to the rollout, pending Cabinet's decision. There's still some water to flow under the bridge around making sure the studies are finished around that younger age group, and of course then consideration of that approval, consideration by Cabinet about the timing of that. But obviously if we've built that capacity in the system, we're in a position to continue to roll out to further age groups if those decisions are made. But that would be further down the track.
Do you think the system as it is has enough capacity to be able to do everyone in New Zealand, or will it flow into next year?
Well, that's the intention, and again, in terms of immunity across the population, if there are vaccines, this vaccine or other vaccines that are shown to be have a great safety profile, are tolerated and are efficacious in the younger age group, then we would put that up to Cabinet, and they would make a decision about rolling it out to that younger age group and taking on board the clinical advice, and also, I think, being clear about how to access that group to ensure we get equitable access.
And as I've just indicated in initial comments, the Ministry of Health were anticipating that there would be a likely broadening of eligibility based on MedSafe's advice. So they've already been talking to the Ministry of Education. In fact, it was several months ago where I recall visiting a school where they said to me, look, if it turns out that we do have eligibility, we are ready here to support a wider rollout. Many schools will remember having been part of widespread rollouts for vaccine campaigns around MMR and, for instance, undertake vaccine rollout for HPV already. So there is some existing capability within the ministry there too.
It does give the final sign-off next Monday. The 12 to 15-year-olds that live with border workers or have underlying health conditions, would they become immediately eligible to the vaccine?
Yep, that will be part of the discussion that Cabinet has, but what I can share is that, as you've seen, Cabinet has been very inclined, and for good reason, to prioritise those who run the risk of coming into contact with COVID-19, including our managed isolation facility workers. So I know that they will be giving consideration to the fact that we've already vaccinated or offered those vaccines to those families and making sure that we're consistent with that offer.
Enough vaccine supply before the July shipments arrive to cope
Yeah, keeping in mind that we would be talking only then about, for instance, managed isolation facility workers who had children aged between 12 and 16. So a very specific group there, for instance.
Dr. Bloomfield, do you have children that fit into that 12 to 15 age group? And the second part of the question is, what advice do you give to parents who are feeling nervous?
Well, two comments. I have 3 children. They are all older than that age group, but thank you for the compliment. Yes, indeed. And so they're all actually able to give consent themselves. I will be encouraging them to accept the vaccine when it becomes their turn. So saying, as a parent, I also carefully considered, when they were born, the opportunity around childhood vaccination, and having been trained in public health, it wasn't until I was a parent that I realised actually it is an important and significant decision as a parent to be making that decision. And so I would be encouraging parents, just as they are for themselves, to inform themselves, to get the information so that they can make the right decision for their 12 to 15-year-olds and potentially in the future for younger children if they have them.
Prime Minister, can I ask a question other than COVID?
Sure, do you mind, Barry, if I'll just canvass around a couple
just
more?
that we've got, some of us have deadlines that are a bit earlier than others.
I'll just do a quick canvass. Can I see how many more COVID questions I have? I've got 2. I think we can try and whip those in. So here, and then I'll finish with you, Derek, and then I'll come to you, Barry.
Will you be doing anything specific, any particular campaigns to reassure those parents who do have hesitancy for their children?
We've, as all the way through our COVID vaccine campaign, we've tried to provide information across the board for all individuals who are eligible. But certainly, if we do get that final approval stage through next week, yes, we will be considering how we can make sure that parents have the specific information they need to give themselves assurance. But I'd say, I would ask nothing of a parent that I wouldn't be willing to do myself. And I think that's the way that everyone who works in healthcare is approaching these decisions. Okay, last one, Derek, and then I'll come to you, Barry. It's just I need to relieve
Dr.
Ashley.
Bloomfield, which is not exactly COVID related, but...
You're going to take liberties, are you?
Anyway, I understand that you own a double cab. Do you think you have a legitimate...
Derek, you can ask me any questions like that, but I don't think it's fair on Ashley that we critique his vehicle at this point. So,
welcome to answer.
All right, I'm going to finish up. So, Justin, it was yours for Ashley as well, was it?
For both of you.
Okay, last one. Sorry, Barry, and then we'll come to you.
Just use of the COVID-19 Tracer app has been down consistently. We're down to about around 200,000 people a day. With the added risk of the travel bubble with Australia and what we've seen in Victoria and New South Wales, do you have any plans to increase use of the app?
Look, from the government's perspective, continually we've been reinforcing the point this is not just an app that we ask people to use when they see cases within New Zealand. It only works if, in the event, we have a case that arises, if we are able to track back on people's movements up until that time. So it's important that everyone is constantly vigilant. We have conversations around whether or not we need to step up, in requirements such as mandating use. We didn't land on mandating use in the past because enforcement's such an issue. You're therefore asking someone who runs a small business not to let anyone into their business if they refuse to use the app. It does throw up some issues, but we will, again, just keep reminding people, as Health does as well. Anything further?
Just to say we have done some research to help understand what are the things that would support people to use the app more, so we'll be providing some further advice through, and we're constantly upgrading it, and including the functionality, so that if it's adding more value for people, I think they'll be more likely to use it.
Yeah. Okay, thank you, Dr. Bloomfield. Okay,
Prime Minister,
go ahead, Barry.
Prime Minister, you would have seen the reportage of Winston Peters' address to his annual general meeting yesterday,
Yes.
describing some of Labor's policies as nutty. Would you work with him again?
Oh, look, a couple of things I'd say, Barry. I won't actually, cast back over that period and say anything now that I wouldn't have said at the time. There were a lot of things we didn't agree on, but there were a lot of things we did, and we got good things done. I have never been in the position of ruling in or out those existing parties that I've worked with before, because I've demonstrated that I could work with them. But it feels like a very big hypothetical at the moment for New Zealand First. There's a number of stages before that ever becomes even a relevant consideration.
Claims that the Haupuapua report was deliberately held back from New Zealand First. Is that the case?
That is certainly not my recollection. Because I usually will recall those papers where they've come through and for any given reason they've been unable to progress. That's not my recollection for that paper at all.
Sorry, I also had a Deputy Prime Minister related question. Australia's new Deputy Prime Minister elect, Barnaby Joyce, he's one of the old ones. He has taken a number of pot shots at you and the Labor Party, and your party obviously played a role in him leaving Parliament. First time. Do you need to mend the rift there?
Oh, look, you can only just manage to draw me on a past Deputy Prime Minister in New Zealand. You're definitely not going to draw me in on one in Australia.
Do you have any problems with his policies? Coal-powered power stations.
Look, my role as Prime Minister in New Zealand is to work constructively with whomever is in a democratically elected government in any other country at any given time, and that is what I will do. We won't always agree, sometimes we will, but that's my job.
You asked this morning on the AM show how many extra mental health beds had resulted from your investment into mental health. Have you got that number now?
Oh, no, sorry, Jenna. That was quite a specific thing on youth forensic mental health beds as well, if I recall the question correctly. And no, since I've arrived in Parliament, I haven't been able to, but I'm happy to provide any additional information. As I said on the show, though, we have been in the process of rebuilding facilities across Palmerston North, Hamilton, in Auckland, in Christchurch, and so that work has been a part of our program, but youth-specific, I would need to talk to the Ministry of Health.
Do you think it's acceptable that someone has to sleep on a mattress on the floor in a mental health unit?
No, I don't.
Going up in mental health, particularly for young people, despite the fact that you invested a huge amount in Budget 19 and have been investing in health more generally across your budgets.
Yes.
What's the disconnect? What's not happening?
Oh, look, try and give you a short answer. One of the things that we have worked really hard to do as part of our wellbeing approach is to build more service in those early stages. So for young people, expanding youth health services in schools, across high schools. At the same time, funding our youth health one-stop shops, because we know that they access a number of students who otherwise would not go through a GP to get support. Funding Youthline for those young people who will text or phone if they're experiencing issues. And we're even starting to expand into primary schools to really early on build those tools that support resilience when times may get tough for our young people. So that's been a big focus for us, but undoubtedly what we also need to do is try and expand and extend the access for crisis programs and facilities. And that's an area where it has taken us more time to build the capacity and capability in that area.
Is New Zealand doing enough to help Fiji with help Fiji with the outbreak, and are you concerned about the situation unfolding?
Yeah, look, I think if any of our Pacific neighbours were experiencing the full brunt of Covid-19, not only would we reach out, we would be concerned for them as well. You'll see today we've put additional PPE is going into Fiji. We have an anaesthetist going in as part of a medical team with the Australians who has past experience in Fiji and in their healthcare system. We're also looking at sending in a Defence Force infectious diseases specialist. Additional funding is going in today as well, and that's not just for their health support, health response, but we are very concerned about, in any lockdown, there are welfare needs, issues around poverty, access to food, and we really want to support Fiji in that as well. For the vaccine, we've been working closely with Australia. That issue has not yet been obviously resolved where we've made an AstraZeneca donation, but until they're approved in New Zealand, we're unable to pass on those doses. So instead, we've been working with Australia, who are able to support them sooner with doses into Fiji.
Active communication with Fiji about how they're coping, how the government's feeling about whether they're under control or not,
yeah,
and future help from the likes of New Zealand or Australia.
So the offer we've made is a consistent one. We've said to Fiji at any time, if there is any assistance we can provide, just reach out. It was the Prime Minister who instigated the last call we had, so demonstrating to us that they are willing to let us know if there are things that we can support them with, and we will. But at this point in time, I do think that really practical assistance, support on the ground, PPE gear, and financial support in order to help households overcome the impacts of lockdown, access to food and so on.
Over the week.
Yeah, I'll come.
What do you think of ACC analysis that finds the scheme is biased towards women, Māori and Pacifica?
So this is an issue that the Minister for ACC has been wanting to get a better understanding of how equitable and fair our system is. And so she's asking all of the right questions here. So yes, you might have a higher incidence of workplace accidents or even sporting injuries amongst males in New Zealand, and some of that will be, very easy to tell a story around based on the areas in which they work. However, women are more likely to be declined. And so this is where the Minister is really digging into some of those issues, including issues she's seen with Māori and Pacifica, to assure ourselves that we have a system that is operating fairly for all New Zealanders.
Would you consider the new Māori Health Authority having authority over ACC for Māori?
Oh, look, that isn't at this stage. There is a delineation there of sorts. What my expectation is that every agency, if they identify an inequity, that they resolve it. And so that's something that the Minister's leading on. But that's not to say that there won't from time to time be crossover. Because, of course, you see sometimes crossover between, campaigns and issues that ACC will fund and that the Ministry of Health will fund.
Your Transport Minister wouldn't rule out any changes to the fringe benefit tax rules around utes on the weekend. Is that something that you would rule out changing over the next parliamentary term?
Oh, look, I always like to preserve the position of Cabinet to make these decisions, so I'll continue to do that.
Wouldn't then fall foul of your kind of, no new taxes that weren't mentioned in the manifesto rule? Would it be a new tax because it's changing a loophole to an existing tax?
Oh, again, this is not something that we've had any recent discussion on, but I'm not going to make off-the-cuff decisions here at this podium. Let me check that if I've missed anyone that hasn't had much of a question, Mark, and then I'll come back to you, Gina.
The fee-based scheme is expected to reduce emissions by 9.2 million tonnes over the next 2 decades. What do you say to this national act to say, because the ETS has a cap, that will just allow other emitters to emit that much over the next 3 decades?
Yeah. The whole goal of our work program as a nation has to be to reduce down overall our emissions profile. And so the emissions reduction plan and plans across sectors are a really integral part of making sure that we are overall reducing our emissions profile. And at the same time, I think it is in the next 12 months that at the same time as alongside emission reduction plans, of course, there's the regular review of the cap as well. For those parties who say that we should just rely on the ETS, my message would be that that won't necessarily change our profile, and it can lead to really high household costs in the future unless you're doing the work on mitigation and just reducing our overall emissions.
Gina. Sorry, back on mental health. The crisis services that you've acknowledged need to be beefed
ongoing
up.
work, yeah.
Given the nature of those services, that they are crisis services and they're so desperately needed at that point, how urgent is that work? How quickly can you get more resources into that area?
But of course, one of the issues that's being raised with us who work in the sector is trying to reduce down the number of people who are finding themselves in a crisis situation in the first place. And in some cases, that will be because we haven't had the primary mental health care that people have needed early enough. So we have been working on trying to really build that system. 10,000 sessions a month are now being provided for New Zealanders through often their healthcare provider, and that was support that just wasn't available for. So yes, we've made significant change, but there is more to do.
I guess then the question is, did you tip the balance too far at the front end?
It has to be about doing both. Maintaining the crisis support services, but also doing what we can to provide support earlier for those who may need it.
Is it worth reviewing
Derek, and then did I see Ben? Yep, and then a little bit greedy on the side, so we might wrap up after that. So yeah, Derek.
Is it worth reviewing the Ngāwhenua project that received PGF money, which one of the beneficiaries of that project potentially is it co-owns some of the land there, used to work for Shane Jones, and Jones himself can't remember the conflicts of interest he declared or whether he knew at the time he signed off that his former staffer was a landowner.
Yeah. So my understanding, again, I wouldn't mind taking a little bit of time on this particular scenario, but one of the things, of course, that we manage with the Cabinet Office is in not every scenario, if someone is known to someone, does that necessarily represent, and I say as a general principle, does that necessarily represent a conflict of interest? So what we rely on is Cabinet Office giving some guidance as to when they determine something to be a conflict of interest and when they don't. Because as you can imagine, New Zealand being a small place, it's not unusual for someone to just be known to someone who applies. But again, I wouldn't mind just taking a bit of time on the particular example you've given me because I only had it shared with me recently.
If you were signing off something like that and you knew that a former staffer of yours was part of it.
Yeah, I would just ask the question. You know, if it's someone that worked with me 10 years ago or so on, I would ask the question and get some guidance.
Isn't it worth at least looking at that project to see if all the...
Again, if it's only recently been put to me, so let me just take a little bit of time on your question. Ben.
On indulgence, we've seen...
It's not a good way to end, Ben. I've given you the last question.
It's a way to start. We've seen the dramas that went into Clark making the cake. I wanted to know the reaction from Neve from the cake.
I feel like you've just ruined everyone's reputation by asking that question. And so, what was it you wanted?
Neve's reaction.
Oh, Neve's reaction. She's 3. Everything's exciting. That's what I would say. All right. Thank you, everyone.